Hello, welcome to Ravlic at Large. My name's Tom Ravlic. Thank you for joining me for this particular episode. One of the things that we have consistently seen governments do is spend lots of money on a range of causes, whether it be aid overseas, whether it be sending bushmasters to Ukraine, whether it be advertising on a range of things. But one area where the dollars aren't always well spent is how we look after ourselves, and in particular in the National Parliament. In recent times, we've seen a debate about looking after politicians and others taking place in the context of the Jenkins report, which some of you may recall talked about improving the culture and the well-being of the workplace, people working in Parliament House and the workplace in its entirety. One of the recommendations in a piece of work, the feasibility study, was that there be a GP on site in the federal parliament. That had been pursued by Victorian Senator Jane Hume, a coalition senator who has basically questioned people at Senate estimates about why it is we could not do better. What is an on-site GP all about, and how might an on-site GP improve the way our leaders work, how staff work? Well, there's an expert that we'll talk to, Dr. Mike Freelander. He's a member of the Federal Parliament. He's also a qualified paediatrician, has been for many years. We'll be talking about this and more in today's episode. Mike, thank you for joining me.
Thanks very much for having me on, Tom. It's a great pleasure. This is an area that I've long had an interest since I came into Parliament 8 years ago, almost 9 years ago. And I was quite shocked about it, really, that access to medical care, not just for politicians, but for staff and for parliamentary workers, was very poor and very difficult, and a barrier to people getting good health care in what is a pretty high-stress environment.
Now, let's take things back a little, because there will be those who are watching this who don't know your background. So if we can put them into that context before we go into your first perceptions or the reality of Parliament when you walked in. When did you qualify?
Well, I qualified in medicine in 1978 and as a paediatrician in 1984. You're taking me back quite a long way now.
That's all right.
Yes, and then lots of changes in the health system, and was a medical student when Gough Whitlam introduced Medibank, the precursor for Medicare, in 1973. And then when, after Medibank had been dismantled by the Fraser coalition government, when Bob Hawke introduced Medicare in 1984 to resurrect the universal healthcare insurance system in Australia, which has been a great promoter of public health in Australia over decades.
You entered Parliament in 2016, correct?
I came to Parliament in 2016 from my electorate of Macarthur, where I've worked for 40 years as a paediatrician. And was quite shocked with some of the requests I was getting for healthcare in the Parliament from both staff and politicians.
What were the kinds of things that people would come to you with at that time when you're a newly minted MP? You walked in, you're a representative, and you start getting questions. What are the kinds of things that people would ask for your assistance with?
Well, I suppose the commonest thing that I'd get a knock on the door, usually early one morning, and people would say, "Look, I've come to Canberra from various different places around the country, and I've forgotten my medication. I'm on regular medication. Could you do me a prescription?" Well, my first question was, well, I'm not a GP. I'm a paediatrician. You should go to a local GP. But then it was explained to me pretty quickly that people couldn't go out of the building because of the potential for divisions, etc. They didn't have a GP service linked to Parliament House, and they didn't have time to go and see a GP. So I was asked to do a prescription. Then the next part of that was, what medication are you on? Oh, the little blue pills. And of course, no idea of dose or what the pills were actually called or whatever. So that would often require a call to the person's GP in whichever state they came from. So really a lot of those sort of things. But then, a lot of corridor consultations, like, I've been getting this pain in my abdomen. What do you think it could be? I've suddenly had an episode of dizziness. What do you think I should do? Et cetera, et cetera. One person came to me who said, I've got this lump in my neck. What do you think this is? Well, it was a classic goiter, actually, from thyroid problems. And so I was trying to sort out some of these health problems in the Parliament, not infrequently, which I didn't mind doing. I've done, when I was trained to be a paediatrician, I did quite a lot of general practice as a second job to try and earn some extra money. So I've done a fair bit of medicine over the last 50 years. So I didn't mind helping out. But I think in terms of people getting good health care, it would have been good for there to be a general practitioner in the Parliament that people would go to, that they could confidently get some health care. They wouldn't have to disclose their health issues to one of their colleagues like me, and staff also in a similar situation. They have the right to have their health care kept confidential, and I certainly would never talk about anyone's specific health issues and name them, but it is important that people are able to access healthcare in confidence, knowing it wouldn't get back to their bosses or to their colleagues. So I thought it was important. We did look to see, what could be done, and there was a little bit of interest from some of the local practices, but I felt the Parliament itself had made it difficult for that to be established by asking for quite large rents, commercial rents for a room, and putting all sorts of conditions on it. And I still think it's worth revisiting. One of the problems, of course, with the Parliament is that there's always people in the building, but it only gets really busy on sitting days, sitting weeks. So there is a fluctuation in numbers of people in the building. And I suppose when Parliament's not sitting, it's easy for people to leave the building and get access to GPs. So it would need to be a service. I think best one of the local general practices could do some part-time work in the building, but they need to be encouraged to do that, and it needs to be made both physically and financially viable. But I still think it's important, and that goes for a whole range of health issues, from issues with some of the kids that are in the building whose parents are working in the building, either politicians or staff, to the politicians themselves, and to the Parliament House workers themselves as well. So I think it can be done, but it needs some encouragement from the Parliament itself.
Now, you mentioned that it was explored at one point. Can you walk me through how it was explored? Because the Department of Parliamentary Services sits beneath the Speaker and the President as presiding officers.
Yep. Well, I met with those presiding officers, and then they had some contact with the Parliamentary Services. This is going right back to 2016 when I first entered Parliament. And the sticking point was getting enough interest, number one, from the local general practices, and I did talk to a few of them. And number two, then getting the Parliamentary Services to make it financially and physically viable to run a clinic in the Parliament. And that's where the stumbling block was, I think.
how did you find out about the stumbling block? What was the process for learning about the fact that it was unlikely to get anywhere?
Well, I met with some of the people from Parliamentary Services following meeting with the presiding officers, and it sort of went nowhere from there because they were insisting on commercial rents and finding enough space and what sort of services would be provided. There is a nurses' station, as you know, in the Parliament where there are nurses there to provide nursing services. And I think there's a physiotherapist that visits once a week. But it was a matter of trying to develop a service that would be a more comprehensive GP service. And that, of course, requires significant investment in the building itself, in setting up a GP practice, and in getting the GPs to come up there and making it financially worthwhile for them, in the knowledge that, we have a shortage of GPs around the country. So, there's plenty of work. They don't have to come to Parliament House to get work. And, I think it could have been a good thing to start, but it was, in the end, for the GPs that I'd spoken to, it wasn't worth their while, they felt, to do it. Now, the world's changed since then, having said that. And I think there is an acknowledgement now that health services and mental health services are important for people in the building, across the gamut of workers there, from parliamentarians, other staff and workers there, and that it can be difficult to get that in a coordinated way. And I think, it is time to revisit it, and it needs to be done, of course, in a very bipartisan or multi-partisan way. I've discussed this now with some of the other doctors that are now MPs, and there are more of us now, of course, and we've subsequently had the Jenkins report. I think Parliament's a better place, I've got to say, to have more doctors in the building. But that might
it doesn't feel so lonely, does it, Mike?
Beg your pardon?
It doesn't feel so lonely, does it?
No, not at all. It's great to have my paediatric colleague, Monique Ryan, there. She's fantastic. Gordon Reid from the Central Coast of New South Wales, who's doing his emergency training. He's fantastic. We've always had David Gillespie. David and I are great mates. Michelle Anandaraja, infectious diseases physician. Sophie Scomps, GP. They're all great people, and it's really, I think, brought health into the parliamentary spotlight a lot. And I've spoken to them all about this, and I think it's a pretty good idea, and it's great to have them there.
Now, let's take it one step back. You mentioned the importance of mental health and the importance of an overall focus on well-being. Can you describe to those people who don't fully comprehend what a day in Parliament might be like, so they better understand why it would be advantageous to have an on-site GP in the joint?
All right, well, let's take it from the point of view of the Member of Parliament.
Okay.
We arrive at Parliament usually on a Sunday evening, often after a pretty busy weekend, usually going to functions and things. So people arrive on the Sunday. Most parliamentarians are in the building, around the same time as me. I get in there by about 6:45. Then you've got emails to deal with and stuff that's happened overnight. Lots of the ministers are there before then, and they're dealing with media, etc. So then it's, Parliament starts. There's always a risk of a division where you have to be in the House. Very difficult these days to get a pair where you're covered for the division, and you can leave because it's quite a contentious place now at the moment, or has been for the years that I've been in Parliament. and it's very hard to get a pair. So you can't leave the building. It means that you often skip meals, you're racing backwards and forwards to a variety of different meetings with stakeholders, lobbyists. We run a lot of health, my office runs a lot of health meetings in the Parliament to try and acquaint parliamentarians with a variety of particularly paediatric health issues. So people miss meals, they don't have time to do much other than their meetings and then speeches they've got to make on different pieces of legislation, committee meetings. I'm on 5 different committees. They meet during the week, and that looks at things. I'm the chair of the Health Committee, but I'm also on the Ag Committee, Agriculture Committee, the NDIS Joint Standing Committee, and a couple of others. It's a really, really busy day. Parliament itself doesn't stop for the members till about 8 o'clock. The senators can go even longer, and occasionally the House goes longer than 8. Then you've got to find some dinner. There's often meetings outside of the Parliament after that. So people just don't get the time to leave Parliament to see a GP, see a psychologist, see a physiotherapist.
Okay.
And
What are the realistic? What are some of the most obvious health impacts of that run of activity on a given day?
Well, it's a stressful environment. And, people are often hyper vigilant. So they tend to be, always worried about when the next division is going to occur, getting to meetings on time, giving speeches on time. And it can affect health because people aren't eating properly, they skip meals, they eat rubbish. It's hard to get good food into the Parliament, although it's a little bit better in the last couple of years. But people often miss meals. A lot of parliamentarians, have weight problems because of lack of regular exercise and poor diet. Many of them have other health issues. They're no different to other people. They have things like high blood pressure, thyroid problems, asthma. There's a couple of people with asthma who don't look after themselves. Some of them have heart problems. Some of them have, I've seen a whole range of problems in the Parliament, from heart disease to neurological problems, autoimmune disease. So that's in the MPs. The staff are the same. There are a whole range of things. And it's a very high stress environment. The staff are often expected to be there early and leave late. They, write speeches, they organise meetings, they're dealing with stakeholders who are ringing and emailing the office. We've always got our constituency to worry about, things are happening in the office and in their local areas. So the staff work really hard. They really do. And they don't get paid that well. And they similarly may struggle to get out of the building to be able to see the health practitioner. And, there's lots of them there. There's thousands and thousands of people in the building on a sitting day, well over 5,000. And, they certainly need support. And I think it's, a decent workplace that would allow them to get that support. And hence my call for this. Now, it's completely bipartisan. I'm not doing this for any political reason. I think the Jenkins report got it right, that people, are at risk and they do need the ability to access confidential support.
You mentioned earlier, if we can go back to something you said before, which is I guess a critical point. You may be a paediatrician, you may be a medical practitioner, but you're also a member of a political party. And there are some complications with, the political side of life. Can you just touch on those a little bit in a little bit more detail in relation to how people might feel going to see somebody? For example, in your case, who's a paediatrician, but is also a member of the opposing political party.
Yeah, well, look, people have approached me about a whole range of health and mental health issues.
And
they deserve the right to be able to discuss those issues confidentially without their colleagues, either in their party or in opposing parties, knowing about it. I think that's really important. And I have certainly had people approach me with confidential information about their own health and mental health that I feel uncomfortable about being given, right? I don't really want to mention specific things, but it's ranged from things like sexual health to mental health to a whole range of things.
Okay. The key point being, it's not information. A political environment has a premium, and then outside of a one-on-one confidential relationship that isn't based on contacting someone from the opposing political side for assistance. It can be pretty challenging to have that frank conversation with people.
Yeah, definitely. Yeah, it doesn't have to be from the opposing political party. There's things that you may not want your own party to know about.
Yeah, we see cases of even in the slightest, even merely administrative matters that end up colleagues in political parties having a crack at each other over for their own reasons. But I know you and I have spoken previously on the issue, and there's been material appearing in the Mandarin. Over the past 12 months, has there been, from your standpoint, has there been an increase in awareness of the necessity and a greater deal of conversation about it?
Look, I think over the last couple of years, there has been an increased acknowledgement that MPs and staff have stresses on them that can lead to mental health problems, and that part of that is also physical health problems, and that they should have the right to access proper support, be that medical, psychological, or otherwise. And I do think that's a basic human right, to be able to access healthcare when you need it. And I think that there are impediments in place in the way Parliament works to stop that. Now, people tell me, people who've worked in previous parliaments, even going back decades, that it is more difficult now to leave the building, and that access to healthcare is harder now than it has been. And that's not a good thing. And we have that responsibility to ourselves and to our staff.
If I look at the parliamentary website and I look at some of the evidence given by officials from the Department of Parliamentary Services, who will say that they've developed the online list of various services available for people, or various clinics people can go to in order to get the attention they require, and that there would be privacy pods if they want to ring their GP remotely, all of that sort of stuff. I think I know the answer to this, but do you think that is adequate from the point of view of a place that's effectively a village on its own, sitting on a hill?
I think that the ability to reach out to people online is good, but it could be better. And I think that there's nothing better than actually having a GP who you can visit in the building on a one-to-one basis, who actually cares about you and your healthcare. And I think we could do things a bit better than just having online access. I think the same thing is probably true, for example, for other healthcare workers that we could experience, including, psychologists, physiotherapists, allied health people, etc. So I think it could be done better. I'm not saying that parliamentary services hasn't improved things, because I think they have. But my personal view always is that the GP is at the centre of healthcare and has the ability to coordinate the care that people need, and has also the ability to do health assessments if required. And we've certainly seen that. We've seen some, significant problems in the building. We've had people who've had heart attacks. We've had people who've had problems with hypertension. We've had people with epilepsy. We've had people with acute mental health issues. And I think if we had a GP on site, certainly on those very busy sitting days, that would make a difference to the quality of care people get.
And you've been generous with your time, Mike. I think another reflection that we need to probably touch on, and that is, if we are healthier, our ability to make decisions is more sound. Is that a reasonable assumption?
I think it's a very important statement of fact.
Right.
That can lead to poor mentation and poor decision making. Yeah.
So the next point being, the National Parliament makes serious decisions about all aspects of life. How concerned are you about the capacity of your colleagues and their staff to be able to make sound decisions on policy that impact on the broader country without greater medical assistance?
Yeah, look, that's important issue. I'm pretty confident that the Parliament makes the right decisions in the long run, mostly. Has people's health interfered with that? I don't think there's a lot of evidence for that, really, in the modern era. I think Parliament works better now. There's certainly less of some of the behaviours that have been previously reported, alcohol intake, that sort of thing. But as always, the health of the parliamentarians and the people that work for them and the staff in Parliament House is an important thing in the way debates are conducted, for example, the way that people deal with each other. And I think good healthcare is an important part of making the place function in a more humane and a more collegiate way as well. So I can't say that there is any evidence that I've seen that poor health has impacted on any of the major legislative decisions. And I think that's in the time I've been in Parliament. Perhaps in the bad old days, it would have, where Parliament used to sit all night and people were tired and had large alcohol intakes, but that is not happening now. So things have improved, but I still think in terms of basic humanity, that people's access to decent healthcare is really important, and I think this having a GP in the Parliament would be an important adjunct to that.
That's a convenient place on which to conclude. I've been talking to Dr. Mike Freelander, who's a qualified medical practitioner, paediatrician, who's been campaigning solidly for the time he's been in Parliament for a neutral GP to be in the building to be able to see politicians, their staff and parliamentary workers across the board. Mike, thank you so much for your time. You've been extremely generous.
Thanks, Tom. Good to talk to you as always. It's going to be an interesting year, isn't it?
Very much so.
Good.
And now thank you for watching Ravlic at Large. I will be back with another episode fairly soon. In the meantime, take care, look after each other, and stay safe.